Officials are seeing an increase in cases of pertussis, or commonly known as whooping cough, all across West Virginia. We have Dr. Matthew Christensen here from Valley Health to share what we can do to protect ourselves and our families. Thank you for joining us.
Yeah, thanks for having me today.
Yeah, so when we hear about whooping cough, I know me as a parent, I'm like, oh goodness. So what is causing this increase from a medical perspective?
So whooping cough is a bacteria. It's not common in West Virginia, but there are sporadic cases every year in the state of West Virginia that come about. It is treatable with antibiotics, but it is important to try to prevent it and catch it early. It's something that's preventable with vaccines. We hear about the DTaP or Tdap vaccine. The P in that is pertussis, which prevents people from getting this bacterial infection. And in young kids, it can be really serious. And so it's important that your viewers know to check with your primary care providers and pediatricians to make sure that they're up to date on that vaccine. But it is circulating at a very high rate this year in West Virginia because we have strong vaccine numbers here in West Virginia. It's usually fairly rare to see this big of an increase in cases this early in the season.
Oh, okay. Okay, Dr. Christensen, what are the symptoms that we should be watching out for, especially if we have young children and infants in our care?
Sure. So early symptoms are fairly nonspecific. They can look like runny nose, itchy eyes, red eyes, dry cough. Really, the middle stage is where it really develops this classic whooping sound, where the cough is really severe. And it's distressing when, as a parent, you will know if your kid has it. It sounds like, it's called whooping cough for a reason. When those kids are coughing so severely, they inhale, and when they inhale, it sounds kind of like a whoop. And so sometimes kids can cough so severely that they end up vomiting. It's really it's very distressing for parents, and it's important that they get care as quickly as possible.
Okay, so how does a doctor diagnose whooping cough and treat it, and when should they really consider seeing a doctor?
Sure. There's a couple circumstances under which someone should go and check with their primary care provider. One is if they've been exposed to pertussis. There are medications that prevent people from getting pertussis that can be written, antibiotics that can be written early on, or even if they don't display any symptoms. It's important if someone at your school or work has told you, or you've heard through employee health or school health, that someone has had pertussis and one of your family members has been directly exposed, it's important to call your primary care provider and get some preventative medications, or at least talk to them about those medications. If people are having symptoms of whooping cough, again, that severe cough, certainly with any symptoms, it's important to get checked out. It can be diagnosed through a laboratory test that can be sent off, and it's a very good test, and it's pretty quick to come back. So it's something that, again, it's important that, number one, people make sure they have that vaccine, Tdap or DTaP vaccine. If you're exposed, call your primary care provider, and certainly if you have symptoms, get checked out.
Okay, now what about a booster? Is that ever an option for someone who did have the vaccine?
Absolutely, there are boosters based on age. There's a standard for kids. There's a standard vaccine schedule that they will need to get those vaccines at regular intervals. For adults, though, it's recommended that we get a booster every 10 years. So adults can get pertussis as well. We've actually had an increase in adult cases here in the western part of the state and the Huntington, Cabell County area recently as well. So it is important to know that even though the severe symptoms are usually limited and hospitalizations to younger kids, adults can get it and can transmit this bacteria as well.
Okay, and Dr. Christensen, before we let you go, what can families in the community do to help stop the spread of this?
The most important thing is, if you're feeling sick, stay home. The other important component of prevention is making sure you have that vaccine. You're up to date on that vaccine. It's very safe and protects people from pertussis very effectively. If you have any early symptoms, get checked out and get treated, because the longer you have symptoms, if you do have pertussis, the more people you can spread that to. Washing hands, making sure if you do have a viral or upper respiratory illness, you're covering your mouth when you cough, and trying to limit your exposure to other people through school, work, or church.
Okay. Well, Dr. Christensen, really helpful information. Thanks so much for being with us.
Thank you.